Hello, my name is Nurse Pauline RN. Welcome to my channel. Today we'll be talking about assessment and diagnosis. This is part 2. There is a video out there on part 1, questions and answers. There is also a video out there on assessment and diagnosis. Today we're doing part 2. Please hit the like button, please subscribe, please share this video. My first question is, what do we mean by organization of data? Organization of data. The correct answer is grouping related information. When you admit your patient and you ask the patients all these questions, subjective data, objective data, we talk about organization of data. Our next question is, what is focus assessment? Focus assessment. The correct answer is information that provides more details about specific problems and expands the original database. Focus assessments target specific body system where patient demonstrates a problem, where patient demonstrates a disorder, a concern. These are focus assessments. We are admitting our patients. We're taking all these data about our patients. Subjective data, objective data, and now we did a head-to-toe assessment. When the patient came in, we were asking the patient, what brought you here today? Right? We are narrowing down our head-to-toe assessment, and the patient said, I came for abdominal pain. That's what brought me here today. This is your focus assessment. You did your head-to-toe assessment. Now the abdominal pain is what brought this patient here today. So here comes our focus assessment, which the correct answer targets specific body system where patient demonstrates problems, disorder, or concerns is your focus assessment. Our next question, what is your developmental assessment? What is your developmental assessment? The correct answer is working with children. Some of you will be working with pediatrics. Gathering database assessments, verbal skills of children and their comprehension. Developmental assessments are also, it includes physical, cognitive, psychosocial stages of growth and development. When you admit your patients, you have to consider developmental assessment. Is this an elderly patient? Is this a child? Is this a baby? Developmental assessment includes children's language, intellectual, physical, emotional progress. So these are all developmental assessment. When your patient first comes, you have to consider your developmental assessment, and you'll be documenting them. You'll be recording them into the computer. My next question is, this question is, how do you assess your patients? How do you assess your patients? This is another question. And the correct answer is, you do a head-to-toe physical assessment. In order to do an assessment, you have to know the medical diagnosis. You have to know the pathophysiology of your patient. In nursing school, we all do pathophysiology of medical diseases. When your patient comes up from the emergency room, when the doctor decides this patient is going to be admitted into the hospital, the doctor is going to write a medical diagnosis. So by the time the patient comes up to you, the doctor would have written a medical diagnosis of this patient. So assessment is also knowing your patient's medical diagnosis and knowing the pathophysiology of the medical diagnosis. Assessment. In order to do a physical head-to-toe assessment, you have to look, listen, feel, smell. Use your senses. All your senses. Look, listen, feel. You palpate, you auscultate. Assessments are also can be abnormal presenting symptoms. Assessment, you will assess all abnormal presenting symptoms. What brought you here today? I'm having abdominal pain. This is an abnormal presenting symptoms that you're going to assess. This is your focus assessment. So assessments can be subjective data, what the patient say it is. Pain is always what the patient says it is. Pain on a stage of 0 to 10 is what the patient says it is. It's not what mom at the bedside says it is. Pain is what the patient says it is. Pain is your 5th vital signs. Your assessments are your subjective data, what the patient says. I'm nauseated, I'm dizzy. Only the patient can tell you this. And assessments are your objective data. All the data you have collected, diagnostics, medications, vitamins, developmental, height, weight, these are all assessment data. My next question is, when you are assessing, you have to know your body's symptoms. You have to assess all your body systems. Head to toe assessment. You assess your body systems. Focus assessment on target specific body part. Problem, concerns of the patient. Our next question: when analyzing data, the nurse examines what? The correct answer: when analyzing data, the nurse examines the functional health patterns of the patient. What are your functional health patterns? Your functional health patterns of the patient are, for example, when you are admitting your patients, you're collecting a lot of data, you're gonna do analyzing of all your data as you go along. You're gonna do functional health patterns of the patient. That means we're gonna find out how the patient have been functioning at home before they came to the hospital. Was this patient coming from a nursing home, a total care patient? Total care means the patient was unable to do anything for self. The patient had to depend on other people to do their grooming, bathing, dressing. We have to assess functional health. Was this patient mobile? We have to assess function of mobility. Was the patient ambulatory, walker, wheelchair, cane? What was the home maintenance of this patient? Were the patient preparing their own meal? Did they have to depend on someone to do it? Meals on wheels? Were the patient able to toilet themselves? Were the patient able to cook their meals for themselves? Nutrition of these patients are very important. So when we have all our data, we have to analyze data on our patients. We need to know the functional health of our patients. What was the functional health of the patients before they were admitted? They are coming from a nursing home. They were coming from a home. So on date of admission, the nurse will know, okay, you say to your tech, this patient is a total care patient that's going to need us to do everything, because at home, at the nursing home, the patient was dependent on help. We are going to say to the tech, this patient was able to walk with devices. Here, the tech will help us to get a walker, wheelchair, or something for the patient. We are comparing the functional health of the patient at home. Next question. When formulating a nursing diagnosis, the nurse examines the functional health of the patient. Excuse me. Have a good day.